My name's Andy.
I'm Hannah.
And I'm John.
And we're nursing students from Concordia, and we're just going to teach you guys a little bit about COVID-19. So we have this video for you all to watch.
In December 2019, there was a cluster of pneumonia cases in the city of Wuhan in China. Some of the early cases had reported visiting or working in a seafood and live animal market in Wuhan. Investigations found that the disease was caused by a newly discovered coronavirus. The disease was subsequently named COVID-19. COVID-19 spread within China and to the rest of the world. On 30 January 2020, the World Health Organization declared the outbreak a public health emergency of international concern. In this video, we'll take a quick look at what is currently known about COVID-19. Keep in mind that this is a new disease, and what's known is rapidly evolving and might change in the future. So what is a coronavirus? Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by a lipid envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause illness in animals and humans. In humans, coronaviruses can cause respiratory infections ranging from the common cold to more severe diseases. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012, and SARS-CoV-2, the name of the virus that causes COVID-19 that was first reported in December 2019. So, where did this new virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors, such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels, and SARS-CoV from civet cats. The animal reservoir of the new coronavirus is not known yet. How does the disease spread? The disease can spread from person to person through droplets, when an infected person releases those droplets through coughing, talking, or sneezing, for example, when close to another person. It can also spread when infected droplets land on objects, and when another person touches them and then touches their eyes, nose, or mouth. What are the symptoms? The incubation period, which is the time taken from exposure to the virus and development of symptoms, is on average 5 to 6 days, but can range from 1 to 14 days. There can be a range of symptoms, from very mild to severe. Some people may not develop symptoms. Common symptoms include fever, fatigue, and respiratory symptoms such as cough, sore throat, and shortness of breath. Some people reported loss of their sense of taste or smell, and some may develop a skin rash. In more severe cases, there could be pneumonia, organ failure, and sometimes death. About 80% of cases recover from the disease without needing special treatment. But there are some people who are at risk of serious illness. They include older people or people with underlying medical problems, such as chronic respiratory disease, obesity, diabetes, high blood pressure, heart disease, or cancer. How can we tell whether someone is infected? The infection is commonly diagnosed by a test called reverse transcriptase polymerase chain reaction, generally known as PCR. This test identifies the virus based on its genetic fingerprint. There's also a blood test that can check for antibodies against the virus, which may show that someone was infected in the past. How is it treated? The treatment for COVID-19 is mainly supportive care. Medicines against the virus are currently under investigation. How do we prevent transmission of the virus? There are a number of effective ways to prevent the spread of the disease. These include covering your mouth and nose when coughing or sneezing with a flexed elbow or tissue, and throwing the tissue in a closed bin immediately after use. Wash hands regularly with soap and water or an alcohol-based hand rub, maintaining at least 1 meter distance from people, and the appropriate use of masks and personal protective equipment, especially in health settings. It's important to stay home if you're feeling unwell and to call a hotline or your medical professional. But if you have a fever, cough, or difficulty breathing, seek medical care early and share your travel history or contact with someone unwell with your healthcare provider. In some areas, governments have implemented specific physical and social distancing measures to prevent the spread of the outbreak. It's important to follow their advice. Vaccines to prevent COVID-19 are currently under development, and scientists around the world are working hard to make this happen. That's a quick look at this emerging infectious disease. We're still learning about this virus every day, and what's known may change. So please, check the website below for the most up-to-date information.
So that video had a lot of good information on it. It told us that the coronavirus is obviously a virus, and that often there are multiple different types of coronaviruses, and they usually come from animals. And some common symptoms we can see with the coronavirus, we can see runny nose, fever, cough, vomiting, diarrhea, and other respiratory symptoms such as shortness of breath or difficulty breathing. And when you see any of these symptoms, you're going to want to tell a trusted adult. So whether it be if you're at school, you can tell your teacher, or if you're at home, tell a relative or your parent, just so we can keep other people safe and keep you safe as well by treating the disease.
So you guys have all been doing a really good job wearing your masks from what we have seen. But just a reminder, the proper way to wear a mask is over your nose and your mouth. And we wear a mask not only to protect ourselves, but to protect others. And the people that we're protecting are those people in that risk group. So older adults or anybody with previous health conditions. And it also, again, protects you. We want to be social distancing at this time. So that would be about 6 feet. So that kind of differs. If you are 6 feet away from somebody, it could be approximately how far me and John are. So just keep that in mind and try and do that at all times, especially if you don't have a mask handy. Just make sure you stay away. Germs can spread quickly, and they can spread through surface, droplet, or airborne. So things can live on the surface that you touch. Droplet would be as if somebody were to sneeze or cough, and airborne is any of those droplets that are traveling through the air. So it's very important to cough in your arm and wipe down commonly touched surfaces and wash your hands frequently, which we'll talk about how to do properly.
So there's a proper way to wash hands that really ensures and slows down the spread of the germs. So I'm sure you guys have all washed your hands your whole life, so I'm not going to teach you every step of it. However, I just want to emphasize some important factors to remember when washing hands. So make sure when you're washing your hands to use the warm water. The heat will kill more germs. And then also when you're applying soap, make sure you're doing so for 15 to 20 seconds. So you could sing a song if that's something, or just count. And when you are applying that soap, make sure you're getting it in between your fingers, you're getting your thumbs, get your wrist, and even under your nails, just to make sure you're wiping and the germs off of every surface of your hand, so you're spreading them less. And sometimes that you should be washing your hands are when you're done using the bathroom, when you come from inside, and just when you touch very commonly touched surfaces. Obviously we can't wash our hands 24/7, and that's why there's Germ-X available, just if you're looking for something quick. So that's always a helpful tool as well.
All right, so we don't have a Kahoot for you guys, but we have a fun little quiz for you all to take. So grab out a sheet of paper, a pencil, so that you can write down your answers. So our first question is, how many deaths have occurred in the U.S. from COVID-19? So we'll give you a little time to answer. The correct answer was 206,000 people. And again, this is deaths, not who has tested positive for it.
So true or false, the cloth mask prevents you from getting COVID? The answer is false. It does lower the chances, but anytime you interact with someone, your chance of getting COVID increases. So that's why it's important to wear the mask, though.
Once you get coronavirus, you cannot get it again. So the correct answer was maybe. If you chose maybe, great job. We don't know for sure because the virus is always mutating and changing. Viruses can change over time. So if you got the coronavirus one time and you might get it again, that could be a totally different virus. So there's still a lot of research and information that needs to be gathered about that.
Is it okay to be within 6 feet of someone without a mask for more than 15 minutes? True or false? If you picked false, you would be correct. That's because you don't want to be within 6 feet of somebody for more than 15 minutes, especially if you're without a mask. So just make sure you're always carrying a mask with you.
How many cases has the US had so far? So the correct answer is 7.2 million, which seems very high, but it's important to remember that there are a lot of people in the US. It's also important to remember that sometimes people can get the virus multiple times, and sometimes the people are also asymptomatic. However, the number being so high is just a good reminder to follow the basic steps of social distancing, mask wearing, and hand washing to prevent yourself from getting the disease.
Next question is, young people should not have to worry about getting the coronavirus. Answer is false. Good job. Anybody can get the coronavirus. It's just young people usually have a better immune response, and they usually don't get as sick as older people or people who have underlying conditions such as heart disease or diabetes.
Which is not a symptom of the virus. This one can be tricky, so it's okay if you get it wrong. So the answer is double vision, and double vision is basically where you look at something and you see two of it when you should really only be seeing one, but that does not occur with the coronavirus that we know of yet. But a lot of times you do see the sore throat, the nausea and vomiting, the muscle and body aches. It's very similar to like how you would feel if you had a cold or a flu, but that's what also makes it a virus.
So how long should you be washing your hands for? So the correct answer is 15 to 20 seconds. So good job if you got that correct. That amount of time just ensures that you have time to get the soap into all parts of your hand and you can get those germs off.
It is best to use warm water while washing hands. True or false? Yes, that is true. Warm water will help kill more germs and it'll keep your hands cleaner overall than cold water. So it's important to remember to use that.
We know how long the virus lives on surfaces. True or false? So the answer is false. And that's because we actually don't know how long it can live on surfaces. So that's why we say you should clean commonly used surfaces as much as possible. And that is the end of our quiz. Thank you for listening to our COVID-19 presentation. We hope that you guys learned something new about it. If you do have any questions, feel free to reach out to your teacher and they can guide them towards us. So thanks.
This is a video on proper hand washing. The paint is going to be our soap. We're going to do several different movements to make sure we get complete coverage of the hands. That movement is, we call it the spider. We get the back side of the hands, then we move to a hug. And then we make sure we get our thumbs. And then we roll the dough with the tips of our fingers, the fingernails. And then we make sure we get our wrists, our bracelets as well. And then after that, just do another quick overview of your hands and then rinse them and you should be done.